Hello, my name is Joan Reede. I'm Dean for Diversity and Community Partnership at Harvard Medical School, and it's my pleasure to host this week's Voices from the Community. This week we'll be taking time to talk about our Harvard Medical School Task Force on Diversity and Inclusion report, some of its recommendation, and how these recommendations relate to what's going on today. What's going on at this crossroad of the COVID-19 pandemic, with its disparate impact on certain communities, and these painful times that we're experiencing with violence and blatant racism. Briefly, the Task Force on Diversity and Inclusion was established in 2017 by Dean Daley, and members of our faculty, our trainees, students, staff, administrators joined together to really study 4 issues with 4 goals: to look at the landscape of our current diversity and inclusion resources and offerings, to develop a diversity and inclusion vision, statement, and policy that would be consistent with our mission and values and responsive to regulatory requirements, to identify measures of accountability to assess our achievements in diversity and inclusion, and fourth, to identify and prioritize needs, goal setting, and making recommendations for action. In this process, 6 committees met over more than a year. A diversity statement was developed and launched with our community. A diversity policy was adopted unanimously by our Harvard Medical School Faculty Council. And the Better Together plan that came out of this task force was utilized in our LCME self-study. There are 4 themes from this process: developing people and infrastructure, building community and belonging, addressing culture and communication, and holding ourselves accountable and generating knowledge. Today, we're joined by 3 members of our Harvard Medical School community, and I'm going to ask each of them to introduce themselves and tell us what they've been doing in the wake of these very challenging times. Dr. Landry?
Thank you, Dr. Reed. My name is Alden Landry. I'm an emergency medicine physician at Beth Israel Deaconess Medical Center. And I'm also the Assistant Dean for Diversity, Inclusion, and Community Partnership at Harvard Medical School. Over the past few weeks, since we've been in this situation where we've been dealing with the COVID pandemic, in addition to working clinically, one of the things that I've been responsible for is hosting the Equity and Social Justice lecture series. This series focuses on addressing both historical issues related to medicine as well as the current context and environment we've been living in. Specifically, what we've been doing with our ESJ lecture series is talking about the impact of COVID on marginalized, vulnerable populations and how they're dealing with COVID. We've talked about the issues related to both children and families. We've talked about vulnerable communities, such as Native Americans, Black and Latinx communities. And we've also talked about the overall health and well-being of our healthcare providers and how COVID-19 is having a negative impact on us and how we can better care for ourselves during this pandemic.
Dr. Nour?
My name is Nour. I'm an obstetrician gynecologist at Brigham and Women's Hospital. I'm an associate professor and chief diversity inclusion officer for faculty, trainees, and students at Brigham Health. It's my pleasure to participate in this week's Voices from the Community. And I want to thank Joan Reede and George Daley for their leadership during this time. Under Dr. Reed's leadership, the HMS affiliate hospitals and faculty trainees were able to participate for the very first time in a Harvard Pulse survey asking their perspective on diversity, inclusion, and belonging issues at HMS. And pre-COVID, we were actually the hospital that piloted the survey, and it was our honor to be the first hospital to be piloting this survey. It's critically important to understand the relationships that affiliate faculty have with the Harvard Medical School, and specifically for our underrepresented minority and women faculty to have a voice in this way.
Thank you. Dr. Gonzalez?
My name is Karina Gonzalez Herrera. I am the Associate Director of Diversity and Minority Affairs in the Division of Medical Sciences at Harvard Medical School. And I am also part of the Office of Diversity and Minority Affairs in the Graduate School of Arts and Sciences, which oversees all PhD programs. My primary focus is to oversee diversity efforts for the 6 PhD programs in the Division of Medical Sciences. And as you all know, the life sciences at Harvard is a broad and rich community, and thus I have the opportunity to work with students in the 14 life science PhD programs when it comes to diversity, inclusion, and belonging programs and initiatives. In addition to trying to homeschool my 6-year-old kindergarteners, I have been working with colleagues in the Graduate School of Arts and Sciences in the Office of Diversity and Minority Affairs on efforts to support our PhD students and recruitment efforts. Before the outrageous and violent acts of racism that we are currently living in, and at the beginning of this pandemic, we have been supporting the students in various forms. Some of the things we have done are daily virtual check-in meetings, as well as virtual social activities for affinity student groups to keep the community connected and to have everyone come together to support one another. The students have organized virtual practice exam talks where students as well as postdoctoral fellows from the various PhD programs have joined to provide constructive feedback and to support one another. We have also been engaged with recruitment. We have had a newly admitted Students' Day in which various members of the student groups have participated. And one of the positive pieces of news is that I'm happy to share that 18% of the incoming students for the DMS programs are members of underrepresented minorities, and this is a number that has been increasing over the years. In addition to this, we have been focused on adapting the Summer Honors Undergraduate Research Program to a virtual platform. And this program is one of the first to be established in the country. It has been running for 30 years and has close to over 600 alumni. And over 95% of the students have gone on to pursue PhDs, MD PhDs, or MD degrees. Over 80 participants have returned to Harvard and matriculated into PhD programs. We have also been adapting the long-running Native American High School Summer Program into a virtual platform. And I would like to thank Dean Reed for inviting us to participate in this Voices from the Community recording.
Thank you. And thank you for all that you're doing. You know, when we talk about diversity, inclusion, and belonging, oftentimes we think of it as words, but it's not just words, and it's not just about numbers. It requires a change in culture and thinking about our culture and our environment where people work and learn. And Dr. Nour, maybe you could talk a little bit about what this has meant in the Brigham and Women's Hospital or in the medical school as we've looked at COVID-19's impact and the racial unrest that we see today.
Thank you, Joan. I mean, first, I think it's critically important to actually acknowledge, as I think we all have, the way in which COVID-19 has truly impacted our Black, Latinx, and Indigenous communities and continues to do so. You know, I try to always look at that silver lining in the midst of these really critical times. And I think being able to have hospitals see this, visibly see this, has brought about a true change and a rapid change in the point where health equity became part of the incident command. So we had a health equity task force that was formed to address the rapidly evolving and changing environment of the COVID-19 epidemic. Not sure that would have happened in the past, but I think given all the diversity, inclusion, and health equity work that we have been doing over the past has helped people be prepared that this is an important aspect for cultural change, and that cultural change has been on the shoulders of all of the people who have been doing the work prior to this. The Health Equity Committee really focused on work streams on employee equity, data and monitoring, communications, community outreach. There was a lot of community outreach and in order to do testing at our community health centers. Again, unheard of in the past, but it really gave us a chance to look holistically and with a lens on race, ethnicity, and the disability status. The mere fact that we all took it for granted that we should be wearing a mask, never thinking that individuals who are deaf may not be able to, read lips. And so having partners who would be able to help us identify that disabilities we need to have the clear mask was critical at this time, and really helped us all learn how to look at this issue with a diverse lens. And all of those might have seemed small aspects to our care turned out to be huge and very meaningful to our patients and to ourselves as health providers.
Thank you. I'm just going to ask, Dr. Landry, you have been in the ED throughout this. Can you speak a little bit about what this has meant for the culture? What have you learned or thought about in terms of the culture of the ED and the culture of the hospital for now and to carry forward?
So I can talk about it from a number of angles, but what I've recognized is that in the emergency department, we were initially looking at this disease as being, as they called it, a great equalizer. And what we realized, it wasn't a disease that impacted our communities equally. And we saw that some communities were more vulnerable and suffered greater losses than others. And I think we can all appreciate that greater than 100,000 deaths from a disease is a national catastrophe. But when you look specifically at what's happening to poor communities, inner city communities, when you look at what's happening to the Native American communities, if you think about what's happening with Black and Latinos as we're dealing with COVID, we started to see where the health disparities truly lie. And unfortunately, COVID really opened up some people's eyes to the fact that health disparities were so prominent. And many of those patients that we were taking care of in the emergency department came from those vulnerable populations that I just mentioned. And I think it was really an eye-opener for some of our colleagues to see how we need to make systemic level changes in order to improve the care and the health for these populations. And it's not necessarily a rising tide lifts all boats mentality, but actually looking at how we can address and do precision attacks or precision interventions to improve the care for certain groups, both in the acute setting right now as we're dealing with COVID, but then also sort of what are the long-term changes that we need to make in Boston? What are the long-term changes we need to make in Massachusetts? And what are the long-term changes we need to make as a country?
For all of you to think a little bit about sometimes when we are in challenging times such as we are today, with this pandemic, with this racial unrest, sometimes we lose sight. Our eye turns away from the prize. And here I'm talking about diversity, inclusion, and belonging. Can you give some examples of ways in which our community has stayed committed? Are we still offering programs? Are we still moving forward on some of our diversity efforts, even though times are hard?
So yeah, one of the things that we're trying to do is make sure that we continue to engage the communities that have come to depend on the programming that Harvard has put on in the past. One example is the Visiting Research Internship Program, which is an amazing program that brings students from all across the country to come and do research at HMS, typically between their first and second years. And we've transitioned this program so that it's going to be done virtually, so that those students who are looking for that enrichment from a research perspective are still going to have access to those opportunities, are still going to have access to the networking and mentoring experience, and then are still going to have the opportunity to produce high quality research that can ultimately help to shape both their careers and also healthcare. So we're excited that we're able to continue that program. Another program that we have is Project Success, which is a program targeting high school students, either matriculating into the 12th grade or those who just graduated from Boston and Cambridge public schools. And so those students are now able to do their programming and their research opportunities, again, virtually, with the same implications, hoping that they gain that mentorship and that exposure in their careers in the health professions so that they can think about, next steps in their career growth. And hopefully we can encourage those students from disadvantaged backgrounds to pursue careers in the health professions. And then lastly, I'll mention that the visiting clerkship program, which has been ongoing for over 30 years the visiting clerkship program, which has been going on for 30 years. This is our 30th anniversary for the program. Typically brings students from across the country. Upwards of 100 students come to Harvard and come to our teaching hospitals as medical students to do visiting clerkship rotations. Because of COVID, we're not able to host those students, but we are trying to make sure that we continue to engage those students, because we know that it's not just the experience of coming and doing a rotation, but it's getting to know the culture of Harvard, to getting to know the people here through the program directors and the residents, and then getting a better understanding of what Boston as a city has to offer. And so we're engaging these students in a different format through webinars so that they get to know about us, they get to meet some of our program directors and residents, but then they also get to know a little bit more about the flavors of our institutions. And hopefully we can use this as a vehicle to recruit those students to come and participate in our residency programs. And hopefully we can convince them to stay even longer as faculty at our hospitals.
Thank you. You know, as we talk about this and continuing this work, this very important work moving forward, part of this is also about infrastructure and maintaining what we've had, but also developing new infrastructure to move us forward. And I would ask Dr. Gonzalez and Dr. Nour to both maybe speak to that in terms of what you see as important components of this infrastructure. Is it being carried forward? And what new things might be in the works for our institutions?
I could take the lead on that. I would say that even though things are now in this virtual platform, what I have seen from the students being there for each other, supporting each other, has been great. And, it keeps me motivated and optimistic. In addition to the students, as I planned the Summer Honors Undergraduate Research Program, I have had a lot of support from faculty who are willing to step in and lead some of the computative components of the program, as well as to virtually mentor a student and allow a student to join during their lab meetings so that they can learn about the research that the labs are conducting. Some of the other things that I have been working on with colleagues and with students are different ways in which we can change the culture at Harvard. And so one of these programs is the DMS Culture and Community Workshops. This is a program that was initiated with students from one of the programs in the Division of Medical Sciences. And it was a collaboration between the students, one of the program directors, as well as the program administrators, and our Office of Diversity. And the goal of the program is to provide some education and an opportunity and a space for reflection for incoming graduate students to learn from one another and understand that we all come from different places and we all have something to bring to the table and to contribute. And I think this is something that we hope we can expand to additional PhD programs so that other students in the life sciences can also take advantage of this. One other program that we have been working on as well is the Graduate School of Arts and Sciences Summer Institute. And this is a program mainly focusing on enhancing retention efforts by exposing incoming graduate students from underrepresented backgrounds who are going into PhD programs in the life sciences, to expose them to curriculum and enabling the students to build a support network and community, which is so important during grad school. As part of the program, the students are participating in a series of academic, social, and professional development activities prior to the start of the first semester of graduate school. And so I think these are two of the newer programs that I think can help in increasing diversity and inclusion and belonging at Harvard Medical School.
Thank you. And Dr. Nour, in terms of infrastructure and programs and work that's being done through the Brigham and the hospitals.
Yeah, so it's, we had to also be creative and think outside the box. So with our programming, when it came to our faculty or our trainees, most of the programs that we've had available, mainly the retention programs to be able to help individuals with research projects or funding for any innovative programs that they'd like have not skipped a beat. We continue to do that. When it came to our summer programs, much like what has happened at Harvard Medical School, we have summer programs for African Americans and Native Americans to come and do research at our institution and collaborate with principal investigators. And we had a great group for the summer, but unfortunately because of COVID, we weren't able to bring them here. But our thoughts have continued to, we've actually added an extra component that they will be coming next year. So they are assured, that they can actually continue this program, but with an extra benefit that they are already linked to the principal investigators. They've already started the work. They've started thinking about the research. They're learning more about science and their own interests. And so that by the time next year, next summer arrives, hopefully no COVID, that they'll actually be further ahead in their research and hopefully maybe even end up with some sort of publication, which is our goal. We're trying to ensure that they understand our culture as well. And then we're also looking sort of more on an institutional level of how do we change our culture in the midst of all these crises, COVID, race, violence, and how do we bring people together in these moments to be able to truly discuss race and racism and structural racism, and be able to feel comfortable with these hard discussions, but really trying to create an action plan on how to change our own structure, our own policies that we may not have been paying attention to that already have some underlying inequities.
It's interesting, and they talk about out of adversity, there's also opportunity. So I actually think that there's ways in which this has brought our community together that we might not have had. I think much of what we're talking about here will live beyond COVID. Use of the virtual has allowed access that we have not had before, and connections that we've not have, and expanded our reach within the local community as well as nationally. But it's also brought up, it's sort of lifted that rock in terms of disparities, issues, institutional racism, all those things that exist across our society, that exist in our institutions, where we weren't shining a light on them. And it's forced us to shine a light. And I think with our Better Together, with this direction that we have for our task force, it gives us an opportunity to not say this is something we look at for the moment, but this is something we have to stay committed to. That this is long-term involvement, long-term commitment. It's coming from our leadership from the top, from our dean to our presidents, to our department leaders, to our faculty and our students and our staff. It's our entire community coming together around creating sustainable change and moving us closer to the ideals that we express in our mission and our values. Thank you all for being with us today. Stay healthy, stay safe.